So what's interesting here about this one that seems a little different is like with the Biotronic use case, the remote access is used to access, I'm presuming, another workstation on the other end, which then controls the pacemaker and so on and so forth. There's the programming and that kind of thing. So essentially there's no passing back and forth of any kind of patient data or anything that would be considered data that needs to be kept private. Versus this use case, it sounds like, even though my assumption of like a screenshot was wrong, but that's okay. So there's some data going back and forth. It is patient data of some kind because there's some analysis being done on the other side, as it were. Security comes into play here then specifically, again, just like it did with the Biotronic example here. What role does security play with remote access, in this use case?
Yeah, I think it's kind of part of, I guess you could call it the table stakes for this. You need to have the basics. You need to have AS128, AS256. You need to have things like certificate-based authentication. That's something they specifically needed. The end user doesn't need to be concerned about this. It needs to be simple to use.